Hi, and thank you for joining me for this post-mastectomy stretching and range of motion routine. This routine is really going to help relieve some of those tight muscles in your neck, shoulders, chest wall, and upper back area following any sort of chest wall surgery. Now, it's imperative that you're cleared by your entire medical team before you begin, and it is ideally recommended that you are at least 3 to 4 weeks post-operative and have had all of your drains removed. This routine will be performed seated in a comfortable position with your feet flat on the floor, and you should be able to maintain a nice, tall, upright posture with neutral spine as we begin. Let's start with 3 deep diaphragm breaths. Okay, rest your hands gently on your lap. Pull your shoulders and shoulder blades down and back, and keeping a nice straight neck, you're just going to drop your left ear towards your left shoulder and feel a nice stretch along the side of your neck. We're just going to stay here for a few breaths in order to start loosening those muscles. Come back to center and drop towards the other side. Back to center, once more on each side. Back to center, and last time. And back to center. Now again, make sure that you pull your shoulders and shoulder blades down or back. Now you're going to drop the ear to the shoulder again, but now you're going to rotate and look up towards the ceiling, and you'll feel the stretch a little bit more in the front of your neck this time. These muscles tend to get very tight when we're in that forward bent and rounded position. Back to center, drop to the side, rotate and look up towards the ceiling, feeling the stretch now again more in the front of the neck area. Back to center, drop, rotate. Back to center, and last one. And back to center. Let's do 10 backwards shoulder rolls. 2, 3. We're really trying to get out of that forward bent position. 5, 6, 7, 8, 9, and 10. What we're going to do now is bring our hands up, keeping our elbows at our side. Again, bring your shoulder blades and shoulders down, back behind you, and trying to keep your shoulders pressed down. You're going to raise your elbows up till you get to 90 degrees and lower down. Squeeze back, raise up, and down. Squeeze back, raise up, and down. We're going to 10. This is 4, 5, 6. Now this squeeze at the beginning of every raise really helps reset those shoulder blade and postural muscles. 9 and 10. Good. Lower your hands back into your lap. Drop both of your hands to your side. Your thumbs should be facing forward. By tightening your abs and your core muscles, you're going to raise one hand up as far as you can before there's pain. Stop, hold just a moment, and then as you lower this arm, you're going to raise the other arm, alternating arm lifts. Now, the key with raising your arms, aside from staying in that pain-free range, yes, you can feel some stretch, but I want you to avoid pain, is to keep your shoulders nice and low. When these muscles get very tight, you may notice that your shoulders all the way up near your ear. We really want to try and keep that space between the shoulder and ear as open as possible. Really get the stretch in the neck and shoulder and feel these isolated shoulder muscles lifting your arms straight up and slowly lowering you down. We're going to do 3 more. And 2. And last one. Great job. Hands in the lap. 10 more backwards shoulder rolls. 4, 5, 6, 7, 8, 9, 10. Now for the next exercise, we're going to clasp our fingers together at the base of our skull. So when we start, our elbows are probably going to be facing forward. The first part of this exercise is just to stretch open our elbows as far as we can comfortably, feeling perhaps a little bit of stretch in the front of the chest wall and shoulders, but there should be no pain. So we're going to go to 5, 3, 4, and 5. And rest. Now what I'm going to do is I'm going to widen my hips out in order to lock my low back and my pelvis bones. So when I attempt this next movement, I will not be getting movement in my lumbar spine. I'll be getting all the movement throughout my mid or thoracic spine, which is what I'm trying to do. So opening my elbows out to a comfortable spot where there is no pain, I'm going to keep my low back still and move my mid back, dropping my right elbow to my right knee. Down and back up. We're going to do this 5 times. Now after surgery, when we're in that protective position for weeks at a time, our spine tends to get very tight and sore. So these small movements should really be isolating these tight spots, and you should feel a lot of relief with just these small movements. Let's switch sides. Now you can see as I'm doing this, there's very little motion and it's all coming from my mid-back. There should be very little, if any, movement coming from my low back and waist area. Last one. Now, keeping this position, again, keeping the hips and pelvis locked out, we're going to do some rotation movements. So slowly try and move both shoulders to the right, center, left, center, right, center, left, center. That's 2. We're going to 5. 3. This feels great, right in that tight mid-back area. Last one. And you can see throughout the entirety of this routine, I've been able to maintain nice, tall posture. Feet back in front of me. Last 10 shoulder rolls. 2, 3, 4, 5, 6, 7, 8, 9, 10. Before we finish, I'd like to try and get a couple of really great stretches in the pectoralis muscles along the front of your chest wall to help loosen up this tight area. You're going to want to be very, very cautious with doing these stretches and truly only go to the point where you first feel a stretch. If you push too much, you may cause some pain and flare up some irritation and inflammation. So you're going to drop your hands to your side, elbows stay straight, and the arms go all the way back. Maintain that nice tall posture and strong core. And if you can, bend your wrists up to get a little more stretch in the forearm area. This is the first position where we're going to open up the chest wall. Drop the arms down, lift up to about 45 degrees. Keep the elbows straight and bring the arms back behind you just to the point of a comfortable stretch. You can either hold here, or again, you can bend backwards at the wrist to get a little more aggressive stretch throughout the arm and in the forearm. And hold here, another few breaths. Again, take note of where your shoulders are. I want a nice open space between the ears and shoulders. And lower down. And for the final position of this routine, you're going to try and bring your arms up to 90 degrees. Keep those shoulders pushed down. Arms go back just to the point of a comfortable stretch. And you can either hold here, or for a little bit more of a pull, bring those hands and wrists back. Really feel that blood and lymph flowing throughout the upper body now. Lower those arms. I hope you're feeling much better and starting to get some relief from all of those tight muscles following your surgery. Comment below if you have any questions, and thanks for joining me. Bye-bye.